Welcome to Lesson 8, Surgical Modifiers, Part 2, from the Captain Surgery, CPC Exam, Medical Coding Course 2026. In this lesson, we'll focus on important global period and postoperative modifiers, including 24, 54, 55, 56, 57, 58, 78, and 79. We'll learn when each modifier applies, how to distinguish similar modifiers, and how to avoid common CPC exam traps. Remember the key sequence. Identify right pointing arrow, determine timing, right pointing arrow, check relatedness, right pointing arrow, verify, right pointing arrow, select the modifier. Let's begin surgical modifiers, Part 2. Before we begin Lesson 8, Surgical Modifiers, Part 2, let's review our objectives. In this lesson, we'll focus on important global surgery and postoperative modifiers, including 24, 54, 55, 56, 57, 58, 78, and 79. We'll learn how to distinguish related and unrelated services, understand staged procedures and unplanned returns, and differentiate surgical care from preoperative and postoperative management. We'll also practice identifying common CPC exam traps and selecting modifiers based on the actual documented circumstances. Our CPC workflow is: identify the service, right pointing arrow, determine the timing, right pointing arrow, determine relatedness, right pointing arrow, check the global period, right pointing arrow, select the modifier, right pointing arrow, verify documentation, right pointing arrow, check NCCI and payer rules. Remember these key associations. 24 equals unrelated EM. 54 equals surgery only. 55 equals post-oxygen monophosphate only. 56 equals pre-oxygen monophosphate only. 57 equals decision for surgery. 58 equals staged OR related. 78 equals unplanned plus related. 79 equals unrelated. This lesson is for educational and CPC exam preparation purposes. Always verify the current CPT, CMS, NCCI, and payer-specific guidance before making a professional coding decision. Let's begin surgical modifiers, Part 2. Now let's learn about modifier 24, unrelated EM during the postoperative period. Modifier 24 is used when the same physician or qualified healthcare professional provides an EM service during a postoperative global period, and that EM service is unrelated to the original surgical procedure. The key question is the EM service related to the surgery? If it is an unrelated medical condition, and the documentation supports that distinction, modifier the 24th may be appropriate. However, routine postoperative care related to the original surgery is generally included in the global package and should not be separately reported with modifier 24. Here's the common CPC trap. Any EM visit during the global period can be reported with modifier 24. That's incorrect. The EM service must be unrelated to the original surgery, and the documentation must support the reason for the visit. Remember, 24 equals unrelated EM during the global period. Your CPC workflow is: identify the EM service, right pointing arrow, check the global period, right pointing arrow, determine relatedness, right pointing arrow, verify documentation, right pointing arrow, check current CMS, NCCI, and payer rules. The final memory rule is 24 equals unrelated EM plus same physician, QHP plus postoperative period. Let's move on to the next surgical modifier. Now let's learn about modifier 54, surgical care only. Modifier 54 is used when the practitioner performs the surgical portion of a global surgical service but does not provide the applicable postoperative care. In this situation, another practitioner may be responsible for the postoperative management. Here's an important CPC distinction. 54 equals surgical care only. 55 equals postoperative management only. 56 equals preoperative management only. For example, a surgeon performs a procedure but will not provide the applicable postoperative management. When the applicable Medicare or payer requirements are met, the surgical service may be reported with modifier 54. Here's the common CPC trap. Every surgery should be reported with modifier 54. That's incorrect. If the surgeon provides the complete global package, modifier 54 generally isn't appropriate. Remember, 54 equals surgery only. Your CPC workflow is: Identify the global procedure. Right pointing arrow. Determine WHO provides post-oxygen monophosphide care. Right pointing arrow. Confirm surgical care only. Right pointing arrow. Check transfer of care rules. Right pointing arrow. Verify documentation. Right pointing arrow. Report 54 when appropriate. For 2026 coding, always verify the current CMS Global Surgery Guidance, CPT, NCCI, and payer-specific requirements. The key memory is simple: 54 equals surgical care only. Now let's learn about Modifier 55, postoperative management only. Modifier 55 is used when one practitioner provides postoperative management for a surgical procedure performed by another practitioner, when the applicable global surgery and payer requirements are met. For Medicare, Modifier 55 is used with procedures having 10-day or 90-day global periods. Remember the transfer of care sequence: 54 equals surgical care only. 55 equals postoperative management only. 56 equals preoperative management only. For example, a surgeon performs a procedure with a 90-day global period, and another practitioner assumes responsibility for the patient's postoperative management. The practitioner providing the postoperative care may report the applicable surgical procedure code with Modifier 55 when the requirements are satisfied. Here's the common CPC trap. Modifier 55 is used for any postoperative office visit. That's incorrect. Modifier 55 identifies the postoperative management component of an applicable global surgical service. It is not simply a modifier for every postoperative EM visit. Your CPC workflow is: identify the surgical procedure. Right pointing arrow. Check the global period. Right pointing arrow. Determine WHO performed the surgery. Right pointing arrow. Confirm WHO provides post-oxygen monophosphide management. Right pointing arrow. Verify documentation. Right pointing arrow. Report 55 when appropriate. Remember, 55 equals post-oxygen monophosphide management only. Always verify the current CPT, CMS Global Surgery Guidance, NCCI policies, and payer-specific requirements before reporting Modifier 55. Now let's learn about Modifier 56, preoperative management only. Modifier 56 identifies the preoperative portion of a global surgical package when one practitioner provides the preoperative management and another practitioner performs the surgery. Remember the transfer of care sequence: 54 equals surgical care only. 55 equals postoperative management only. 56 equals preoperative management only. For example, one practitioner provides the applicable preoperative management, while another practitioner performs the surgical procedure. When the applicable Medicare or payer requirements are met, the preoperative practitioner may report the appropriate surgical procedure code with Modifier 56. Here's the common CPC trap. Modifier 56 is used for every preoperative office visit. That's incorrect. Modifier 56 represents the preoperative component of an applicable global surgical package. It is not a general modifier for every visit that happens before surgery. Your CPC workflow is: identify the surgical procedure. Right pointing arrow. Check the global package. Right pointing arrow. Identify WHO provides pre-oxygen monophosphide care. Right pointing arrow. Confirm the preoperative component. Right pointing arrow. Verify documentation. Right pointing arrow. Report 56 when appropriate. Remember, 56 equals pre-oxygen monophosphide management only. For 2026 coding, always verify the current CPT, CMS Global Surgery Guidance, NCCI policies, and payer-specific requirements. The key distinction is simple: 54 equals surgery, 55 equals post-opus, 56 equals pre-op. Now let's learn about Modifier 57, decision for surgery. Modifier 57 is used with an EM service that results in the initial decision to perform a major surgical procedure with a 90-day global period. The qualifying EM service may occur on the day before or the day of the surgery. The key question is: did this EM visit result in the initial decision to perform the surgery? If the answer is yes, and the surgery has a 90-day global period, Modifier 57 may be appropriate when the documentation supports it. Here's an important CPC point. Modifier 57 is not used for minor procedures with 0-day or 10-day global periods simply because an EM visit occurred before surgery. Here's the common trap. Modifier 57 can be used for any EM visit before surgery. That's incorrect. The EM service must result in the initial decision for the major surgery. Also remember the distinction: 57 equals decision for surgery. while 25 is used for a significant, separately identifiable EM service when the applicable circumstances and procedure rules support it. Your CPC workflow is: identify EM right pointing arrow, check the global period right pointing arrow, confirm initial decision for surgery right pointing arrow, verify 90DAY global right pointing arrow, check documentation right pointing arrow, report 57 when appropriate. Remember, 57 equals EM service that results in the initial decision for major surgery. Always verify the current CPT, CMS, NCCI, and payer-specific requirements before reporting Modifier 57. Now let's learn about Modifier 58, staged or related procedure. Modifier 58 may be used when the same physician or qualified healthcare professional performs another procedure during the postoperative period of the initial procedure, and the circumstances meet the applicable CAPTAN and CMS requirements. The subsequent procedure may be planned prospectively, staged as part of a planned series, more extensive, or related to therapy following a diagnostic surgical procedure. The key memory is 58 equals planned, staged, or related. For example, a surgeon performs an initial procedure, and a second procedure is planned as part of the patient's treatment and occurs during the postoperative period. When Modifier 58 is appropriately reported, a new postoperative period begins for the subsequent procedure. Here's the common CPC trap. Any related procedure performed during the global period should use Modifier 58. That's incorrect. The circumstances matter. A planned or staged related procedure may support Modifier 58, while an unplanned return to the operating or procedure room for a related condition may point toward Modifier 78. And remember, 58 equals staged, planned, related. 78 equals unplanned, related. 79 equals unrelated. Your CPC workflow is: identify the original procedure right pointing arrow, check the global period right pointing arrow, identify the second procedure right pointing arrow, determine whether it was planned or staged right pointing arrow, check relatedness right pointing arrow, verify documentation right pointing arrow, report 58 when appropriate. Always verify the current CPT, CMS, NCCI, and payer-specific requirements before reporting Modifier 58. The key takeaway is simple: 58 equals a staged or related procedure during the postoperative period. Now let's compare Modifier 78 and Modifier 79, two important modifiers used during a postoperative global period. Modifier 78 applies when the same physician or qualified healthcare professional makes an unplanned return to the operating or procedure room for a related procedure during the postoperative period. Modifier 79, on the other hand, applies when the same physician performs an unrelated procedure during the postoperative period. The easiest CPC memory is 78 equals unplanned plus related. 79 equals unrelated. For Modifier 78, imagine a patient develops a problem after surgery and requires an unplanned return to the operating room for a related procedure. For Modifier 79, imagine the patient is still within the global period but requires a completely unrelated procedure by the same physician. Now remember the important comparison: 58 equals planned or staged plus related. 78 equals unplanned plus related. 79 equals unrelated. Here's the common CPC trap. Any second procedure during the global period is Modifier 78. That's incorrect. Ask two questions. Was the procedure related to the original surgery? And, if related, was the return unplanned? If it's related and unplanned, right pointing arrow 78. If it's unrelated, right pointing arrow 79. If it's planned, staged, and related, right pointing arrow 58 may be appropriate. Your CPC workflow is: identify right pointing arrow, check global period right pointing arrow, identify second procedure right pointing arrow, determine relatedness right pointing arrow, determine whether return was unplanned right pointing arrow, select 58, 78, or 79 right pointing arrow, verify documentation and rules. Remember, 78 equals related plus unplanned. 79 equals unrelated. Always verify the current CPT, CMS, NCCI, and payer-specific requirements before reporting these modifiers. Now let's look at an important 2026 special point: global modifiers and NCCI. For 2026, global surgery modifiers must reflect the actual clinical circumstances and supporting documentation. A modifier should never be added simply to bypass an NCCI edit. Important global surgery modifiers associated with NCCI include 24, 25, 57, 58, 78, and 79, depending on the applicable circumstances. When an NCCI procedure-to-procedure edit applies, check the correct coding modifier indicator, or CCMI. CCMI 0 means the edit cannot be bypassed with an NCCI-associated modifier. CCMI 1 means an appropriate modifier may bypass the edit when the clinical circumstances support it. CCMI 9 indicates the modifier status is not specified because the edit is deleted or not active in the applicable context. Here's the common CPC trap. There is an NCCI edit, so just add modifier 78, 79, or another modifier. That's incorrect. The correct modifier depends on what actually happened. Was the service unrelated? Was it a planned or staged procedure? Was there an unplanned return for a related procedure? The documentation must support the answer. Your 2026 CPC workflow is: identify the service right pointing arrow, check the global period right pointing arrow, check the current NCCI PTP edit right pointing arrow, review CCMI right pointing arrow, confirm clinical circumstances right pointing arrow, verify documentation right pointing arrow, apply the modifier only when appropriate. Remember this one-line rule. Global modifier plus NCCI equals check the edit, check the CCMI, check the documentation. And most importantly, never use a modifier simply to obtain payment. Always verify the current CPT, CMS, NCCI, and payer-specific requirements before reporting a modifier. Let's apply what we've learned with a CPC scenario involving modifiers 58, 78, and 79. A patient undergoes a surgical procedure with a global period. During that postoperative period, the same surgeon performs another procedure. The second procedure is related to the original surgery and was planned as part of the patient's treatment. Which modifier is appropriate? The answer is modifier 58. Modifier 58 may apply when the subsequent procedure is planned, staged, and related to the original procedure, when the applicable coding requirements are met. Now let's change the scenario. If the second procedure is related but unplanned, and the patient unexpectedly returns to the operating or procedure room, modifier 78 may be appropriate. If the second procedure is completely unrelated to the original surgery, modifier 79 may be appropriate. So remember, 58 equals planned plus related. 78 equals unplanned plus related. 79 equals unrelated. Here's the common CPC trap. Any procedure performed during the global period should use modifier 78. That's incorrect. Don't select the modifier simply because the procedure occurred during the global period. First ask, was it related? If yes, ask, was it planned or staged? If planned or staged, think 58. If related but unplanned, think 78. If unrelated, think 79. Your CPC decision path is: second procedure right pointing arrow RELATED, right pointing arrow planned or staged, right pointing arrow select 58, 78, or 79, right pointing arrow verify documentation and current rules. The key exam memory is: planned right pointing arrow 58. Unplanned plus related right pointing arrow 78. Unrelated right pointing arrow 79. Don't just memorize the modifier. Memorize the story behind the modifier. Let's review Lesson 8, Surgical Modifiers, Part 2. We covered 8 important modifiers. Modifier 24 means an unrelated EM service during the postoperative period. Modifier 54 means surgical care only. Modifier 55 means postoperative management only. Modifier 56 means preoperative management only. Modifier 57 means the EM service resulted in the initial decision for major surgery. Modifier 58 means a planned, staged, or qualifying related procedure during the postoperative period. Modifier 78 means an unplanned return for a related procedure. And modifier 79 means an unrelated procedure during the postoperative period. Now remember the most important CPC distinctions. 54 equals surgery only. 55 equals post-oxygen monophosphide only. 56 equals pre-oxygen monophosphide only. And 58 equals planned plus related. 78 equals unplanned plus related. 79 equals unrelated. Avoid the common traps. Not every EM visit during a global period is modifier 24. Not every surgery uses modifier 54. Not every postoperative visit uses modifier 55. And not every second procedure during a global period is 58, 78, or 79. Your correct coding approach is: Identify the service right-pointing arrow, check the global period right-pointing arrow, determine relatedness right-pointing arrow, determine timing OR care component right-pointing arrow, review documentation right-pointing arrow, check captain and NCCI right-pointing arrow, select the appropriate modifier. For 2026, remember, an NCCI edit does not automatically mean you should add a modifier. Always verify the current CPT, CMS, NCCI, and payer-specific requirements. And here's your final CPC memory: 24 equals unrelated EM, 54 equals surgery, 55 equals post-op, 56 equals pre-op, 57 equals decision, 58 equals planned, related, 78 equals unplanned, related, 79 equals unrelated. Don't memorize the modifier alone. Understand the story behind the modifier, verify the documentation, and then make your coding decision. Excellent work! Lesson 8, Surgical Modifiers, Part 2, is complete.